body. So there's different types of stress. Things that stress your body would be, I have to get back surgery, and now your body's got to heal and repair from that. I am being deficient in vitamin D for years. I'm stressed, like your body's going to be stressed when it doesn't have the building blocks. And you can have chemical stresses, being exposed, you're walking into a moldy building every day, breathing in mold, or, having sushi every day for lunch. And then you're getting mercury toxicity from your tuna. It's all these little things that add up that really stress the body. And all you're thinking about is the stress from maybe I got to make this, trying to make this revenue or whatever, if it's a business thing. So it's so much more. So yeah, we look for it all. And sometimes what is cool about looking for it all is that some of the other things are easier to fix than some of this mindset on worrying and stressing. But I was like, okay, if you're going to worry or stress, let's make sure that you're not toxic, you got lots of nutrients. So we're kind of fueling and maintaining the body. And then, you can still kind of do what you want to do.
Welcome back to Resilient Entrepreneurs Podcast. Today, we have a very special guest who we're talking holistic health with. We want to explore that vital connection between entrepreneurship, well-being, and success. We welcome Dr. Ayesha Peets Talbot, the co-founder and medical director of Ocean Rock Wellness in Bermuda. Driven by her passion for treating the root causes of illness, she's become a leading figure in holistic health and functional medicine. Wellness is such an important topic, Dr. Ayesha, and one we are very passionate about here at 2 for 1. Without our health, we believe we have nothing. So welcome, and thank you so much for being on the podcast today.
Thank you. Thank you so much for having me, guys.
Dr. Ayesha, let's jump right into the holistic wellness aspect of what you do. Like Laura said, if we don't have health, we have nothing. How do we tie our personal health to the health of our business?
Well, my philosophy is that the health is the foundation. That's almost, I use the analogy of a tree a lot in my practice and how I talk to people about even thinking about the root cause, which is what I get to. But I feel like health, it helps you to show up in every area of your life at your best. So if you are not feeling great, healthy, you're not going to show up to maybe your relationship very well. You're not going to be able to take care of your career very well, or your business, or different areas or facets. And even when it comes to just enjoying other things, could you imagine? So I get to see there's always different levels of health. But truthfully, when people start, yes, of course, it's obvious if you're in a hospital, you're not going to be able to do much. You're not enjoying much of anything. But I see a lot of people who are just tired, fatigued, and really even starting to have brain fog, or just all sorts of issues, that they're not feeling great, or maybe it's pain or whatever they're dealing with. And it's a struggle. They notice different struggles really with getting through. I've actually had really very successful people who have amazing careers, and they get so anxious or they're not feeling great when their health, everything is just like at risk. So to me, health is a super duper foundation. Without your health, it's really important to show up and enjoy everything. So definitely your business, your career is going to be a struggle.
Yeah, it's so good to hear you say that. And it's so true to remember, and important to remember, because often when we are busy building a business, we tend to put ourselves last. And I think it's very much a female thing too, to kind of put everybody else ahead of you.
Yeah. And females might do that. They might be so into prioritizing the business or whatever they're doing. But I also feel males can also have that exact same issue. The males I see are also like going really, really hard and expecting to do a lot and long hours, almost feeling like they're the energizer body. They could keep going. And so they're wearing themselves thin as well. So I see it on both sides. It's nice to see in the sense that is a real important reminder for me, because I try to balance both health and also the business. But to get very successful millionaire, and even we have billionaire clients, and as their health declines, you can see that even some of their independence some of the power, the control that, they've garnered in their earlier lives, all that starts slipping. And it's really because of the health just starts slipping. So it's really a great reminder that you have to focus on your health to also enjoy those fruits of your labor. If you've gotten to that point where things are smoothly running and maybe everything's, like I said, working in the background on its own, which is what most of us are trying to achieve, is not having to grind so hard. Mm-hmm.
Yeah. So, Dr. Ayesha, what 3 things do you consider to be the most important foundation stones for achieving good health?
So I've been told by my mentor that it's not really 3 things. So it's 5 things for me. And this is how I break it down for people. When it comes to health, you want to be eating right, number 1, moving right. So that's having some sort of exercise, sleeping right. So there's could be the top 3. And there's ones we all heard about, but I like to take it a little bit further. You want to make sure that all your nutrients are right. So this is micronutrients. These are vitamins and minerals. Like there's so many deficiencies for us now, and people don't have that on their radar. So that's really big. And then lastly is make sure your hormones are right. And that's hormones for male and female. So male, really notice, I know everybody's thinking testosterone, estrogen, progesterone. Those are the big ones, but I'm also thinking thyroid, I'm thinking adrenal hormones as well. You want to make sure all of that is working really well. And if you're taking care of, you've got all those 5 things like nailed, then likely you're doing really, really good. And your health is really, really, those things, you're focusing on those things, then things are probably doing really good. Yeah.
How does one find out about the hormonal and the micronutrient health that they have or don't have?
You can test. Now. It's not conventional. So it's not like you can roll up into just any family practitioner or GP office. You really have to probably seek out a physician who is doing micronutrient testing, which is what they call it, or also hormone testing. And it's actually quite easy to do. They're very simple tests. One's pretty much you can do urine or blood, and the other one's a spit test. So you're just spitting in a tube, but they can be very telling. So males generally will lose a little bit of testosterone from their very 20, 30-year-old years, but they shouldn't lose too much, and it's always good, even in your 20s and 30s, to really get a really good baseline of what your basic testosterone level is, so that when you're 40 and 50 and things feel not right, you can see how far you kind of slip from that. And you want to just see if you can upgrade that, because that's great for men. Men really need that testosterone. It really helps not only with bones and muscles and their libido, but it really helps with mood. So we can see a lot of depression if a man's not really got those testosterone levels. And women, I know, are like kind of told by the time they're 30, we're starting to see a decline in our hormones. But our hormones are like nosediving now. Like, we're getting so much menopausal symptoms and all sorts of things. But estrogen is what protects our brains. So it's like you don't want to be nosediving more than you need to be, because you've got more stress hormones and your body's preferencing those stress hormones and not making the other hormones. So everything's got to be in balance. So it's even great even to check things when you feel like things are going really great, to get a baseline of where you really live. And then you can see, okay, if things start to not feel great, how far are you from that? But yeah, I think you can get it tested is the point.
So if you're plummeting in these levels of nutrients and hormones, then is the suggestion by you and your medical team to boost it with supplements? Is that how one treats it?
So to us, food is medicine, and medicine is food. And I think that's the core of anything. So it's really important to know that a lot of foods will carry not only your macronutrients. So if you think of carbs and proteins and fats, those are the macronutrients, but you also get micronutrients as well. So those are the vitamin C, vitamin A, or the alphabet. That's where all that comes in. Now, we believe that food starts first, but we also know that as time has come, the farming and probably the soil quality and just how the practice is, that we're seeing less micronutrients in our foods than say 60, 80 years ago. So you can actually have a really, really, really great diet and still need to supplement. But if I see somebody who is like really deficient, I pick up a real true deficiency, then it's like, I think you should supplement. I think you should take a really good quality vitamin, help to boost your body. But if it's a borderline deficiency, I might say, let's get, maybe they got a chromium deficiency. Let's do some more cinnamon in your diet to get it up. It's just a borderline thing. So not to say that you won't be like popping a lot of pills, but I do feel like supplements really play a really great role. And I do honestly think that they have a good place. It really depends on how complex the health issue is or how much the deficiencies are. And they can really help. Really good ones.
I guess all this kind of ties into burnout as well. We were talking earlier about burnout. How do you know if it's hormonal or you're just doing too much?
Well,
that's a good question.
That's all really ties in. So when you talk about burnout, there is a true term. We call it, like a functional medicine doctor will likely, if somebody starts to say, oh, I'm burnt out, and that's what I really do see in my entrepreneurs, my type A's, my go-getters, they're trying to do like multitask and do a bunch of things, then it is the burnout. That burnout medically is called adrenal fatigue syndrome. And what that means is the adrenal glands that are usually giving us all the adrenaline, the go, 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 they start to like tweeter out and they cannot do the go, go, go anymore. And that's the thing about your adrenal glands is they are the master gland that controls all the rest of the glands. So your adrenals control your thyroid, control your sex hormones. And so, yes, it's all tied. So burnout and hormone imbalance is all the same thing. And you can get it all tested and see. But yes, if you're stressed, guess what? Your body doesn't want to make the rest of the other hormones. It's now in survival mode. And it's like, who needs those hormones when I'm really trying to survive? So you don't get those reproductive hormones that make us feel so great. And even the thyroid will suffer. And then your metabolism slows down. And then all of a sudden you're putting on weight and you're tired. So yeah.
Oh, it's just compounding the issues, like one right on top of the other. And is it true it all starts with stress?
It all starts with stress. So that's it. So that's what we test. We test cortisol levels, and cortisol is the stress hormone. And so that's what we see is we see high levels of cortisol level. And so it's all about leveling it out and really controlling those cortisol levels and get them in a healthy range. And it's not sometimes stress that you think of. So it is stress like, oh, I'm worried about this. I'm hoping to get this done. But it's also other things that stress the body. So there's different types of stress. Things that stress the body would be, I have to get back surgery, and now your body's got to heal and repair from that. I am been deficient in vitamin D for years. I'm stressed, like your body's going to be stressed when it doesn't have the building blocks. And you can have chemical stresses, being exposed, walking into a moldy building every day, breathing in mold, or, having sushi every day for lunch. And then you're getting mercury toxicity from your tuna. It's all these little things that add up that really stress the body. And all you're thinking about is the stress from maybe I got to make this, trying to make this revenue or whatever, if it's a business thing. So it's so much more. So yeah, we look for it all. And sometimes what is cool about looking for it all is that some of the other things are easier to fix than some of this mindset on worrying and stressing. But I was like, okay, if you're going to worry and stress, let's make sure that you're not toxic. You got lots of nutrients. So we're kind of fueling and maintaining the body. So yeah, you have lots of entrepreneurs. You can still kind of do what you want to do. Topping up with different vitamins and doing IV infusions now. There's really
oxygen therapy, ice cold baths, cold ice baths.
Yes, ice baths, things like that, all to boost certain endorphins and things like that to keep people on going.
Do you endorse that kind of behavior?
Yeah, no, I mean certain things like IV infusions and nutrients. We don't do them at the office. It's actually been quite challenging to navigate that in Bermuda, but you can go to other places. People go to Europe. I have people go to the US. Certain protocols are really good. I mean, I guess I couldn't say I endorse maybe every single thing, But if you're going to someone who's great and knows what it is, and it's just basic vitamins, it really could help. Again, your body churns through those vitamins, so they could be just a little bit of a top up. You're going to need to do something for maintenance. And I do think that if you have a idea about food, you know what I mean? It's really great because you want to be able to kind of maintain so that you're not so reliant on that. Oxygen therapy is actually coming out is really good, like ozone therapy. What we're seeing is really good. Cold therapy. There's so many healing modalities that are coming out. And I think I realized, Vicky, a long time ago, not to have ego in this business is really important. I guess that's why I'm surrounded by a team at Ocean Rock, because I think teamwork makes the dream work. And there are so many different healing modalities. And healers are not just coming in MD form or DOs, or there's or chiropractic, they're not coming in these forms. They're coming in other forms of acupuncturists and different, I would say, herbalists and homeopaths, and it's such a gamut now. And I think there's real, I guess, results. That's it. There's real, I think the potential and what you can do with these modalities can be really helpful. And I found it very helpful for myself. I have a massage therapist and I have an acupuncturist and, even a homeopath, like different people I can rely on when I know I need this or that to help. So I think it's okay to explore some of these modalities and see how it suits you. I know some people get very much like, if it's not a doctor, like an MD, I'm very nervous about it. I'm not going to do it. A lot of doctors, some doctors are like, go for it and might know a little bit and knowledgeable about, but some doctors vote. And so they would say, I don't believe in that. And I think it can, unfortunately, I think affect the patient negatively and maybe getting a really good healing experience or as something great that could heal them. And whereas they might be relying just on prescription medications, and that's not the end all be all,
It's quite reactionary. I'm sure there's a place for prescription, and obviously there's a very real need for surgery in many cases, but it feels quite reactionary. And I think the things that you're talking about are very much proactive and preventative. And it's great to hear that you as a doctor are also walking your talk and going through all those other modalities as well.
Yeah, I think that's very important. So every test that I do on my clients, I do myself. Protocol treatments I've done myself, so that's been cool. It's really important to walk the walk. I noticed that in general, doctors do tend to live longer. They have better life expectancies in general from the population. But I've also been very aware as I look at colleagues who are like passing away from cancer or having like sudden heart attacks, they're 1 minute, they're gone, that it would be great to take really good care of myself and be really genuinely and have the integrity of giving advice that I've been able to follow. Yes. Yeah.
So tell us, what was your why? Why did you start Ocean Rock Wellness?
Probably me. I would say that's a real good question, and I think it's twofold. So the first one was realizing that I was taught to put on people on medications. I'm a pediatrician and internist trained, and those are one of the most medical professions in the sense that we see lots of clients, lots of conditions, like it's considered necessarily primary care or chronic disease care. And we are pharmacist lovers. Instead, we do a lot of pharmaceuticals, and that's what we're trained to do. And I was realizing that, great, I'm not getting anywhere. The hospital asked me to do an obesity medicine fellowship because of the obesity issues of race that we see in Bermuda. And I was like, okay, sounds good, worth learning. I got into the first conference, I was learning about skinny fat and just, what you could do with diet. And I was like, oh, this is me. This is why I'm fatigued and this and that. And so I switched my diet like right after that, based off of what I was learning. And I was feeling so much better. The hospital never really went with the obesity program. I finished the fellowship, but there was so much teamwork approach. They had nutritionists and physiotherapists and behavior therapists, and everybody was coming on as a team to help people. And I love that model. And so I happened to talk to my best friend, who was very much, she graduated as an MD, but she was very much on a holistic journey. So talked to her, which was Dr. Famous, Sabrina Famous, and then happened to meet Beth Hollis, who was a physiotherapist at the hospital. And so we had nutrition on our belt, we had exercise therapy. I was like, let's open up something so that we can give a comprehensive approach to clients. And I just felt like this journey was helping me to heal. And I was feeling so much better. And I was also dealing with infertility and was able to now have a baby with it. So it was all kind of a cool experience. So moving in this direction of medicine is been also aligned with my health journey myself, but also just a cooler way to kind of go home. Like, I have never gained so much satisfaction as I have now in these last 8 years or so, being able to kind of go at things from a different approach. It really warms this is what I was meant to do, in the sense that this is what I thought I was signing up as a doctor. Might have been different if I was a surgeon. Surgeons are great. They can go in and they can fix it. But if you're not a surgeon and actually not fixing stuff, and you're coming to people and people's like this, I just didn't want to be a pill pusher in that sense, and not get people truly healthy and back to where they belong. Yeah. So that was our why.
Fascinating. And so you brought this team of experts together, specialists together, and this was your first business, yes?
Yes.
So tell us, I mean, how was that? You've built a bit of a mammoth operation in 8 years, and 8 years is quite the milestone. Many businesses don't make it past the first 2 years.
That's what we've heard. So we get really excited when we celebrate anniversary. We're like, you're still here. One thing, we feel like we're not going to go nowhere. So we've had some very challenging years. The pandemic was really hugely challenging. Even despite we had a membership model in place, it was still quite challenging for us. And so, like, failure is not an option for us, for sure. But it's a true journey.
Tell us how you got through some tough times, just in one example. What does it take?
Well, sometimes it takes asking for help. That's true. Reaching out definitely to whatever government aid we could during the pandemic was very helpful for us to just kind of talk to our vendors or our landlord about, okay, we need some help. That, you have to, like I said, like, not have ego. I also think that it's been really good to have teamwork, because when we started Ocean Rock, we had 3 kids between me and our partners. Like, each of us had a kid. And now 2 of us have 3 kids and 1 of us has 2 kids. So we're like 8 kids now. And so there's been a lot of growth outside. And so as women, as mothers too, we're just like, just keep going and trying to nurture everything. It's just absolutely amazing. We have had business coaches. We started taking on business coaches probably, I want to say, our 2nd or 3rd year. That's been really huge for us. Doctors and probably health professionals don't get any sort of business training at all, really. I know one advice that I got just in residency program, my mentor or physician, who I was under at the time, and she said, Ayesha, when you open up your practice, when you get a practice, don't try to do everything yourself. There's somebody else that can answer the phones and staple papers. And I thought that was really cool advice, because you can easily find yourself trying to do everything. And so you have to work to your expertise and find people to help you to do the other things to free up your time. And we've also been told to not work in the business as much as on the business. And so we actually have found that times where because before we was all 5 days a week, really having these tight schedules, and our business coaches are like, no, you have to actually have time to work on the business. And it was interesting how when we scaled back the amount of hours that we was working in the business and started to work on the business by having that real important time, that was when we was able to actually see better profits and things like that. So that's been really huge. And that's something that we've really always kind of maintained. Even when we feel like things are slipping or we need to focus back on our revenues and things, it's always something you want to do, but it's like we need to work on the business, not just in the business. So that's been really cool. So our business coaches have been hugely big help for us, I think. And business coaches, we've had business coaches in our area, so physicians. We have a business coach right now who's actually made it really big in insurance and not just focus. And I think also that's great for us too, not to just have somebody who's limited by just thinking in health field. So it's been huge for us. That's really been important because we're learning so much. I wish we would have learned some more, but it's not an easy thing. I think that it's not something easy to learn. So
there's always more room for growth and improvement.
Yes.
That's the beautiful thing about being in business for yourself.
Yes.
Yeah, exactly. And you go to medical school, you learn how to help care for people. You do not learn how to read profit and loss sheets. Like that's just not what you're trained for. And that's okay.
Yes, and what's gross and net, and trying to figure out gross and net. That's been a challenge for me, but I got it now. Yes. And it's so funny because who really I got it from was Richard Branson. He had a post, and he was like, when he first was coming, and they realized in his meeting that he wasn't getting the difference between gross and net. He was like, is that good? Is that good, guys? They was like, you don't know the difference, do you? He was like, no, I don't. So, he kind of gave an analogy of how he learned about it. I think it was cool. And that's how it's been really able to stick.
I love it. That sounds like fun. I'm going to find that. that. And he's another great example of not letting ego get in the way. For someone like him, you say, well, what's the difference? You know, even before he made it to be the stature that he is now. Very cool.
I think it is cool because that's it. It's so much humility, right? I think the minute you feel like you know it all is the minute you really stop learning. And I think you have to be the forever student, and you have to say, okay, I just don't know this. And then, and I think doctors really have a hard time saying that. And I'm just like, what? I don't know this. And we could figure it out together. So sometimes I have to say that to my client. Oh, I know people who do know it, and I'm gonna ask. And they do appreciate that. They're not necessarily expecting me to know and have all the answers. And I really do appreciate that. And I have to do that in business too, is just ask and figure it all out. Ask questions. Yeah.
Well, one thing I'll say you do have figured out in your business is marketing, because you guys do some pretty cool marketing. First of all, your website is beautiful, but your social media is what I love the most. I've been following you guys for a while, and you guys have a lot of fun with it. So tell me a little bit about that.
Oh, that's so fun. That's the fun I was talking to Vicky about earlier, is that the social media part is just such a cool thing for us. I'll be honest, my partner is our marketing coordinator guru. We do have marketing agencies that help us. So that's another thing. Like, we're not doing everything. We did start off doing it initially by ourselves. It was like, as it builds some momentum, it's nice to get the help. So that's cool. So it's always like, like you said, ask people to help, hire people that have better expertise. So that's been really helpful. And so, yes, but some of it is inspired by us. So the social media is fun for me because I get to scroll through my phone acting like I'm doing research for my next video or like dance that I'm gonna dance to or do something like that. It was fun. And we all bring our ideas and we just go for it. And it doesn't even take us long, truthfully. It's just such a cool thing that we get so much maximum value for us and how we feel. And it's really Friday from like 20 minutes on a Friday. We'll knock out a few reels, have a bit of fun, laugh at each other, not take ourselves too seriously, and then it's cool. Yeah.
That's incredible culture building too. Like
Yeah.
probably not intentionally, but intentionally, because you are actually working together as a team, doing something really fun. That's kind of amazing. I love that. More people should do that.
Yes. So marketing is hugely important, I'm pretty sure. And that we've learned that more and more, how much it's important. And our marketing agency and how we're being coached is people's got to know, like, and trust you. And so they have to know you first, and then they have to like you, which we're lovable, actually. So we'll take it that much further. And then they trust you. And so now you can talk to them about the why. And then that's where you bring in what we really love to do, is help to kind of teach and educate people. So, yeah.
Yeah. And you're really values led too. That really comes through with what you do, which is amazing.
Thanks.
But I'm wondering, because you guys do things very differently.
Yes.
Have you prickled some nerves in the industry? Have you had to deal with some fallout or some difficult colleagues in the other mindsets, I guess I should say?
Not as direct as you think so. Not as directly as you think so. Sometimes we get, and I think it's difficult for the patient, because sometimes they will get conflicting advice from us and feel like they can't go further because the doctor says, no, that's not great or whatever. And they might have a more of a longer term relationship. So it gets really difficult. So it sometimes can be challenging when you're trying to manage someone and everybody's not on the same page. And we try not to ruffle feathers. We actually try not to roll with that, because I think we could go harder on some of the things that we really truly believe in, but we try to be a little bit gentle because there is this mutual respect. But I also feel like some of my colleagues are just so busy doing their life and their grind. And, most primary care physicians have got to see 20 or 40 patients a day, especially in Bermuda. So they don't really have time to pick fights or be like, you shouldn't be doing that. I do generally get people say, oh, thank you so much for your input. And I'm so out of the box. I don't say some of my out of the boxes, that's actually very quiet. It's something I'm not really boasty about. Again, I come from a very humble part, but I have found that a lot of my colleagues, even though I'm like a little on the box, they do tolerate me and do really appreciate my input, because I do feel like I leave people better than when I found them in most cases.
That's beautiful. You also mentioned earlier that there's a couple of things you maybe are limited in providing in Bermuda from is it a regulatory standpoint or?
Yeah, some things it's hard to get in because of customs or just our rules and regulations around things, and the time, because like say stem cells is really difficult. That's been one of the things that's been really challenging for us to initiate, because stem cells have to come on ice and you have to have them, continuously refrigerated and in within 24 hours. So that one gets really, that's one that could be very difficult. As you see, so nobody's really doing stem cells in Bermuda because of that. And so there's things that are logistically, we've even had one supplement that has been like really great. It's a medicinal mushroom supplement. We like mushrooms, especially the medicinal ones. And it got held up in customs for 3 months. And it was where it was touch and go. It was like, are we gonna like lose this money and but the wait list was so crazy for so it does get a bit difficult with certain things, and then some of the modalities that would be really cool, like thermography, which could be an alternative to mammograms, or just even also helping to look for skin cancers or difficult injuries, and you're looking for really hot spots on the person's body without radiation. cool technology, using more heat wave, some of the equipment and bringing it in, and then getting people set it up here can be really a bit challenging. So it's certain things we love and we see and we want to do, but it's just being very strategic at what we can do. But having said that, I have had people come to Bermuda who are Americans and be so grateful that there's Ocean Rock and there's this space, and wishing, oh, I wish this was close to my parents away so that they have something like that. So even though you do have facilities, and probably a lot of functional medicine doctors in the US or different countries, they're very much still spread out since it's a bigger population. So it in some ways we're a little bit even more accessible. Like this type of medicine is maybe even a little bit more accessible than some other populations. So that's cool. It's just that we can't do maybe every single thing like that's coming down the pipeline right now.
Yeah, I do think that's a bit of an advantage about being in this small community, is that we have quicker, easier, faster access to healthcare, which is a good thing, and generally good insurance that covers most things. Not all, of course, but so if you could like have a little crystal ball and wipe away any red tape, what would you like to see for Ocean Rock for the next 5 years, say?
As far as growth in our services,
Yeah.
So we're definitely interested in thermography. There's also a cool machinery type thing that is called a flow presser. It really helps with people with bad lymphedema, issues with like varicose veins, swelling in their legs, and it helps with lymphatic drainage. So some people just are having a tough time detoxing because their lymphatics are sluggish. And so that's been a cool device that I think we have on our radar. I would say we're kind of dabbling into also stem cell patches instead of stem cells. So that's another cool thing that is coming about. Also quantum medicine. So quantum medicine is this cool medicine now that's got a lot of healing modalities around it, but you're using more like physics around some of the machinery that they're using. So healing frequencies, things like that, like machines that do those sorts of things, diagnosing people by biofields, and it's just amazing stuff. So quantum healing and quantum medicine is going to be something huge. I think people are going to hear about. But everything takes about 15-20 years, they say, before it really catches on. So it's going to take some time, but that's something cool that's now started. So, and that's something legit. So you can actually now get a fellowship in quantum medicine. But yes, that they have some really cool tools that they're using. So yeah. Yeah.
I'm fascinated by this stuff. So
yeah.
With these new tools, I mean, what do you see is the future of health? I mean, are you optimistic that people are going to be healthier in the future?
It depends what you do with them. So some of them are, what's great about it is with quantum is some of the diagnostic tools are also can be used for healing, right? So sometimes people come and they want to know, and that's it. And I think that's also driven our healthcare costs way up. They want CAT scans and MRIs and lots of blood tests, and they want to know, and they don't really get the answers they need. And sometimes they do. We do outside of the box testing, and most often we're picking up something, parasites or Lyme disease or mold toxicity, heavy metal toxins. So we're picking up those things. We don't ever want to be like, hey, you got that problem, good luck. We're more about treating it. What's great about these quantum medicine tools is they're really good at diagnostics. So they're really good. I'm being able to use it. I'm using one myself, and it was like, you have this virus in this tissue, and you have this effect in that tissue. And now you can also figure out what to do now, because now you really know the problem. So now when you know the problem, the real problem, you can really go after it good. And so as long as people can respect that the diagnostics are great, but still wanting to go for what's going to eventually heal them, that's going to be where you're going to see all the magic. So, yeah.
Dr. Ayesha, I am going to live to 110. I am.
You are. Yes, you
With
are.
all this technology at our fingertips, that's fantastic.
You have no reason not to.
Hello. Now,
Yeah.
you've mentioned a business coach. You've touched on Richard Branson inspiring you. Is there any other positive influence in your business life, your business world? Any books that you recommend, podcasts you're currently listening to?
So we got a lot of recommendations from our business coach. So my business coach has told us, read this book is great, and we'll go ahead and read it. And I'm really always impressed. So in the last few months, I read the 21 Laws of Leadership. I thought that was really good. It's always good business needs to have a really good, strong leader. I've read books like Start With Why, the Who Not How. That's also a really good book for me. It's just who, not how, not how to do it, but who you need to do it. There's been some really cool books that I've read recently. Goodness. Yeah. And how I do it is I just throw them on Audible. I feel bad because I can't think of everything, but I throw them on Audible. I just finished What It Takes by Steven Schwarzman. He's a big billionaire guy. So he's the chairman of Blackstone. Do you know him?
Okay. I didn't know about the book.
What It
We'll look
Takes.
it up.
That's a good book. That's a good book.
Okay.
Talks a lot about resilience and what it takes to make it to I think his net worth is like 7 billion or something like that, something amazing. So he wrote a cool book. But yeah, I tried to. So I read books like from Tony Robbins and Ray Diallo and some of these guys, and I'm just learning. But I have to say, I got my suggestions from my business coach. They're like, read this book. I'm like, okay. And then, Audible will make suggestions along the lines. And sometimes I'll be like, okay, that sounds like a one to read. I think Beth was like, we need to read a 4-hour work week or something like that. So, okay, I'm reading that, so that sort of thing. Yeah.
That's a good one. So one last question, because we always have to ask this question. What does resilience mean to you?
Because we have resilience in health too.
Of course.
So resilience is taking a licking and keep on taking. And that is it. And that's what you want to be when it comes to your health. You want to be so solid, so built out that things can come and things will. You can get hit by a bus, but be up the next day. Well, maybe, depending on how resilient you are. But it's all about that bounce backness. And so that's, to me, resilience, and having that healthy goal and destination and knowing you're going to make it. So whether it's 110, 120, or it's just whatever that is when it comes to your business, that's, to me, resilience. Yeah.
Oh, that's it. That's it. Well, thank you so much. This has been such an enlightening conversation. I want to dig even further into some of that testing. I'm really fascinated by that. And I just want to thank you so much for joining us today, for sharing all this wealth of knowledge, information, goodness. I'm glad for your optimism. It's making me feel better. We're all living to 110, 120. Let's go. And healthy, living healthy, strong.
Dancing, having fun, traveling.
Yes. There's so much of that. Much of that to come. Anyway, thank you very, very much. We really appreciate your time.
Thank you, Laura. Thank you, Vicki. Thank you, everybody, for having me on. It's been a pleasure. Appreciate you guys.
And that's a wrap for today's episode of Resilient Entrepreneurs. We hope you enjoyed hearing from our amazing guest and learned something new about resilience and entrepreneurship.
Remember, resilience isn't just a trait, it's a skill that can be learned and developed. And if you want to stay connected with us and hear more inspiring stories, be sure to hit that subscribe button and follow us on social media.
And if you know somebody who's a resilient entrepreneur and would be a great guest on our show, we want to hear from you. Please reach out.
Thanks for tuning in, and we'll catch you on the next episode of Resilient Entrepreneurs.